Here's the Grand Forks Herald in North Dakota. The front page there is the story of a local family where the son in that family almost died of acute kidney failure. 19 years old, he became suddenly and violently ill. His family brought him to the closest emergency room at the hospital in Bismarck, North Dakota, but there was no bed to put him in. They tried moving him while he was suddenly and violently ill, tried moving him to the other hospital in Bismarck, but that hospital didn't have a bed for him either. It very nearly killed this kid. Headline in the Grand Forks Herald today on the front page is this quote from his mom. "He could have easily died in my home." Teen's ordeal shows true cost of North Dakota's strained hospitals. Down in El Paso today, same story in the making. COVID-19 patients flood El Paso hospitals. In El Paso, Texas this weekend, the county judge, the top elected official in El Paso County, announced that all El Paso area hospitals are filled to 100% capacity. All hospitals, all intensive care units. They're now opening an emergency field hospital at the El Paso Convention Center. 50 beds, it can't expand to 100. They're bringing in dozens of federal emergency medical workers to staff extra beds in El Paso. They're opening up the El Paso Children's Hospital to adult patients. This afternoon, the local Army Medical Center, that's a Defense Department facility, the local Army Medical Center is now accepting COVID-19 patients from hospitals in the area too. So civilians being treated at the military hospital. They're instituting a curfew now in El Paso, 10 p.m. to 5 a.m. Only essential travel and travel for work allowed during those hours. They are trying to stop people from moving around too much. They are trying to slow down the spread. They're trying to buy the hospitals some time. You know, in terms of that crisis staffing being flown into El Paso, Utah's hospitals may need crisis staffing too. The State Hospital Association in Utah is now warning that they are heading toward rationing care in Utah hospitals, warning that that means very stark, very dire decisions. They may have to start triaging older COVID patients out of the ICU to make room for younger ones who are more likely to live. They may have to essentially start giving up on older patients who need too much care because there aren't enough beds and enough staff to care for them. I mean, even as Utah's hospitals have filled up and the state has considered activating field hospitals to open up more beds, turns out the beds really aren't the issue. The staffing shortages are so acute, it's not clear if beds alone are going to be any help. It's not technically an ICU bed unless it is staffed by trained ICU doctors and ICU nurses, and there just aren't enough of those anymore in Utah.